Hi, everyone. This is an overview of the CPT E&M section, Evaluation and Management. I am going to try to make this very quick, not because it's not important, but because I'd actually like to do multiple videos on this topic and break them down into very small, manageable portions for you, because I personally think that E&M is the most difficult part of dealing with this manual, the CPT manual. And so I'd like to be as intentional and focused as we can be. So I know that your textbook covers a lot of information in chapter 11, and it kind of just jumps right into showing you how to do leveling and things like that. I'd like to take it a little bit slower, just to make sure we all understand the basics. If you do use E&M in your job already, this is probably a review for you. But if you haven't used it in 2021, then this might be helpful because the E&M standards did change this year. So we're all having to learn new ways to do evaluation and management coding. So you might remember from the video I did on tabbing this book that the biggest section is the surgery section, and that's the tabs in green. And those are for procedures where we actually perform some kind of procedure on the patient. That's what those codes are for. And it's separated out by body system. So for the advanced class, we will spend most of our time looking at the codes for these individual body systems in the surgery section. But there are other sections in this book that are not procedures exactly, or are not surgical procedures. So those are going to be evaluation and management, which we're going to look at today, anesthesia, radiology, pathology and laboratory, and medicine. And then, of course, category 2 and category 3 codes. But we are going to start with evaluation and management. We're going to actually spend 2 weeks on it because it is, like I said, rather challenging. So I am just going to give you an overview of the section to kind of explain how it's organized and what you're looking for. Because unlike ICD-10, you are not necessarily going to be flipping to the index to try to find the right code. You're going to come right to the section that you know you need and look from there. So if you want to open it up. So evaluation and management starts on page 18. And there are a lot of guidelines in this section. So there's going to be a lot of things we're going to have to work through. Right now, I'm just kind of going over the basics. So in this section, we are looking at codes that help us get reimbursement for the physician or provider's actual time with the patient. So maybe it's an outpatient visit, maybe it's an inpatient, maybe it's some kind of consultation, but for that actual service, which is not a procedure necessarily. They might do a procedure during that visit, but this actual code that we'll use, that's an E&M code, is going to pay for or be reimbursing the provider for their time and for that effort, which is the visit with the patient. And it might also include some things that are not with the patient. So maybe it's case management, maybe it's reviewing documentation, maybe it's being on standby because there's a very serious case coming in and the physician just needs to be on standby in case they're needed. So there's ways for us to get reimbursement for that. And one moment, I'm going to adjust the lighting real quick here. Okay, so hopefully that's a little bit easier to see. So in this section, the different codes are separated based on the type of patient and the type of service. So in this first section, we're looking at office or other outpatient services. So these are just going to be your basic office visits, right? And for these codes, they are separated out by new patient and established patient. And you might remember us talking about a new patient does not necessarily have to be a patient who has never seen this doctor and never been at this practice before, but they can't have seen this provider within the past 3 years. So I would go ahead and make a note for yourself that it is new. It's a new patient, means it's entirely new, or they have not seen that provider in the past 3 years. Because I can guarantee you that this is something that the national exam will try to trip you up on a little bit. They might be like, present you a scenario where Sarah is going to see her childhood physician. She's been out of the country for the past 4 years. She's going for a regular checkup, and then they'll give you an option of an established patient code. But really, that patient is going to be considered a new patient because they haven't seen their doctor within the past 3 years. So I would just make a note for yourself there. And then established patient has seen the doctor within the past 3 years. So that's what these codes are for. And we're going to get into how we pick the right code, everything like that at a later time. I will say that for most of these, they're going to be looking at how much time was spent with the patient. But that's not the case for every situation. So let's move forward. Hospital observation. So these are going to be when a patient goes in for observation. And they're going to have initial and subsequent. And you're going to see that several times throughout this section, initial and subsequent. And then what I really want you to pay attention to, so these are the initial observation codes, and it's for new or established. So we'll have to look through that and make sure, hey, do they want us to specify is it a new patient or an established patient? For most of the codes that we're looking in here, they're treated exactly the same codes are used. But for some situations, you do have to specify if it's a new or an established patient, just like with the outpatient office visit codes. So what you want to look at here in this section, and anytime you see these 3 bullet points, is this is how we pick the level. So all of these codes are describing the same kind of service, but they are specifying, each code is specifying the level of complexity of that service. So initial observation code is going to be, this very first one is going to be a very low level. So it's going to be not as complex. It's going to be kind of that surface level. And then when you get to the higher level codes, it's going to be much higher complexity. So right here, you can see it's straightforward or low complexity. And then up here, the higher number of codes are going to be higher complexity. And that follows through the rest of the section. So what you want to look at in these codes before you start using them, marking them, whatever, is to see if these key components are required or if 2 out of the 3 are required. So I would come through all these codes that you see, these 3 bullet points, and see if they are required or if all of them are required or if 2 of the 3 are required, because that really makes a difference when we are picking the level and finding the right code. So I would come through, look at all of them and mark them. So for all of these are required. When you get to subsequent observation care, it becomes 2 of the 3 components are required in order for it to meet this level. It still follows the same pattern where the higher number codes are going to be more complex. Are going to relate to more complex, more detailed examinations, histories, medical decision-making. But the difference in this section, unlike the initial observation code, is only 2 of these 3 components need to be present. Now, if you don't understand what that means, that's fine. All I want you to do is to come in here and mark that it's 2 of the 3 components are required, okay? Then we get into inpatient services. And again, it's going to be initial and subsequent. You're going to want to do the same thing here, okay? Your subsequent here, again, initial is required. These 3 components are all 3 required. Subsequent, 2 of the 3 are required. Go ahead and go through there and mark them like I've done here. Then we get to discharge. So you can see how it's kind of progressing. It went from observation to inpatient to discharge. So we're kind of progressing through how a patient would experience an inpatient setting, right? They would start with that observation period, possibly, and then go to inpatient and then eventually be discharged, hopefully. Then we move on to consultations. And again, we're going to want to check and see, are these components required, or 2 of the 3 required? For all of these, they're required. So these are office or other outpatient consultations. So these are outpatient consultations, and usually those are going to be related to an office. So come in and mark and see that all of these 3 are required in order for us to pick those levels. And another thing you'll want to look at in here is the time limits, because that's another part of leveling, and that's something else we'll get into later. How long these services last can also be used to identify the level. So right here, we're at 15 minutes. Here's 30 minutes, 40 minutes, and 60 minutes. And that's another way that we can identify the level. I will say most of the questions you're going to get are going to involve these 3 key components. And they'll also may include this. And so we'll get into more of how to correctly pick the level if we just have the time, or if we have a different scenario where maybe it matches here, but we have a different level of time. We'll get into that. But for right now, I'd like you to just go in and mark that these 3 components are required. And then you can also look at the time if you'd like and highlight that if that's helpful for you. Then we get into inpatient consultations. We are in outpatient consultations. And for these also, these 3 are required. Let's go ahead and mark that. And then we get into the emergency department. And I'll tell you right now, with the emergency department, it does not matter if it is a new or an established patient. So even if they are an established patient with a doctor, they're seeing their doctor in the hospital, and then their doctor takes them by the hand to the emergency room, that is not going to affect the code. Everyone is treated the same, regardless of whether they're new or established. Everybody's essentially new in the emergency department. So now these are all going to have the required 3 components, okay? And then you're going to get into other emergency services, and that's kind of a catch-all code, so make sure you're aware of that. Critical care services, so patients who are in a critical care environment, and those codes go by time. This is going to be our little cheat sheet, so this is very important to note. And then these are going to go by time, so we've got first 30 to 74 minutes, and each additional 30-minute increment. And then we get into nursing facilities. It's important to know that nursing facilities are not the same thing as assisted living. We have different codes for each of those environments. And then we also have different codes for a home setting. So you'll want to look through those and again, mark them that these components are required, or 2 of these 3 are required. And again, it goes initial and subsequent. And then we have other nursing facility services as well. And those have required 3 components too. And you'll see how much I write in these books. And I would hope that you feel comfortable at this point writing quite a bit in your books, because it's only going to make life easier for you. So then we have a rest home, which is also going to include like assisted living, long-term care, those kinds of things. And those do have new patient and established patient, and then make sure you are marking if it's all 3 are required or 2 of the 3 are required. And then we have oversight services. And now we're getting into the really specific nitty-gritty codes. And so I'm not going to spend as much time on those because they're really very specific situations that you're going to use those. We're going to get into them, but the main thing we want to look at here this week is how to pick the level in these codes that require a specific level. Okay, so that's the main thing we're going to do, but I'm just going to flip through so you can kind of see Home services are going to be things that obviously are occurring in the home, but please make note that it can be a hotel, a campground, a cruise ship. It doesn't necessarily have to be the patient's official residence. And I know that sometimes on the national exam, they'll try to trip you up and say, they got a service in a cruise ship, or at a motel or something like that, at a homeless shelter. It still counts as a home service. So that's what's important to be aware of there. And then again, they have new patient and established patient. And it goes from these 3 required to 2 of the 3 are required. Okay. We get into prolonged services. That's going to have that's going to go by time again, and is going to have this fun little cheat sheet, which we will get into later. Services without direct patient contact. We're going to get into all of these things later. I don't want to spend too much time dwelling on them because they are so specific, but you can see we do get very detailed notes guidance that we're going to have to look through. And there's just so many different situations that you can get into with E&M. So there's a lot of guidance and guidelines here that we have to be very familiar with. Preventive services. So these are going to be generally specified by age. So we have early childhood, late childhood, so, 5 through 11, 12 through 17, 1839. So that's important to note. If you want to highlight the ages there, that can be helpful. And then please note that it's preventive services, not preventative. I know most medical professionals heavily prefer preventive to preventative. So if you want to sound professional, use that phrase, or that word rather. And I know you will have questions about preventive services. So that would be if you are coming to get any kind of, routine counseling, history, examination, just to reduce your risk factors, that kind of thing, just things to prevent illness. So these are not going to be accompanied with a real illness, right? Of course, you could find an illness during a preventive service, but that's not the purpose of the visit, right? And then established patient, again, it's going to go by age. So if you want to mark that, then we get into counseling, risk factor reduction. So this is going to be patients that already have a risk factor or a behavioral issue that's impacting their health. And so this is going to be counseling for that. Then we get into telephone services, and that's going to go into several different subcategories, including online digital E&M services, just a bunch of different things that I don't want to spend too much time on, because it is, as you can see, there's so much guidance here to explain exactly what it is that this service is going to be for. And then they are separated out by minutes. The codes are time-based, okay? And then remote monitoring, that's another thing. If you're wearing a monitor, and the storing, collection, interpretation of that data is going to be in these codes here. Newborn care services. So when we think about really complex deliveries, and then those newborn babies being moved into neonatal ICU, or have other critical care services, there are codes specifically for those, including if you are just attending a complex delivery, you're there to assist if needed. So there's codes for that, and you will likely get questions about that. Let's see here. So a lot of these are going to relate just to neonatal pediatric critical care stuff. So we will get more into that. And then we're going to get into cognitive assessment, care plan services. All of these subsequent codes are going to be about the management of care, whether that's teams meeting, your care team is meeting with you or meeting without you, or your doctor is reviewing your plan with you or without you, or doing some other work to help manage your disease without it being an actual service, okay? And that goes into that collaborative care management services, so psychiatric care, people meeting on a team, people meeting with family members, all that kind of stuff. So there's a lot of codes for those kinds of things and a lot of different guidance we'll get into. And then there's a general behavioral health management codes here. And again, I believe those go by minutes. And these here, you can see these have some required terms that have to be met for this code specifically. So we'll get into more of that. And then there's a catch-all code here, because you'd think, man, we have covered every single thing you could possibly cover with E&M with all these codes. You'd be wrong. There's a bunch of things we haven't covered, and that falls into this unlisted E&M service. So that is as quick as I can make it as for a walkthrough, and you might feel really overwhelmed right now, but I promise you we're going to break it down even further. But what I would really encourage you to do now is to go through and check all of these sections with the 3 bullets and just determine if all 3 are required or if 2 of the 3 are required. That would be a good place to start. And then we'll start looking at how to pick the levels based on that information and what do each of these things mean. So the history, the examination, and the medical decision making. Those are going to be the themes throughout this entire section. I also would point out that at the end of the section, there is a notes page. So you have a designated place. You don't have to remember. So this would be a great place to come in and put notes. Once you've done learning about the E&M section, I would recommend coming in here and putting the things that you find most helpful here. Also, I believe we talked about in the last video about these charts and how these can help you pick the right level and pick the right code based on that level. So these are things we'll also use in conjunction with the actual E&M section. So these charts are also very helpful, and we are going to get to learn exactly how to use them throughout this section. So that is what I wanted to cover in this video. It is not going to be the only video about E&M, I promise, but hopefully it gets you a little bit more familiar with how it is set up and why. If you do have immediate questions, feel free to post them in the discussion board, and otherwise we will get to actually looking at the codes next. Thank you.